Hi, this is Dr. Rita Marie Loscalzo back again, and I'm going to be talking today with a really important topic. It's a topic that I have a lot of passion around because I just get upset about the fact that it's overlooked so much in medical diagnosis, and it's the topic of autoimmune thyroid disease. Hypothyroidism is something that was seen very, very little back 20, 30 years ago. In fact, some of the medical textbooks say, oh, hypothyroidism, it's one of those rare conditions that you'll rarely see in practice. And I don't know about you, but I hear it as kitchen table conversation. Oh, yeah, I just got put on Synthroid, or yeah, my mom has hypothyroidism. And lots of my patients that come in to see me, they're on thyroid medication. It's just like giving out like candy. And part of the problem is that the diagnosis of hypothyroidism is vague, and yeah, there's certain parameters, but one of the most important considerations, and one of the most of the cases of hypothyroidism, like I would say 80% or more, are caused by something called Hashimoto's, which is an autoimmune condition. It's actually antibodies, and antibodies are the part of your immune system that attack foreign invaders, right? If you get exposed to a streptococcus and your body's fighting it off, it creates these antibodies to, go out there and Pac-Man and knock it dead. Well, thinking about that, would you like to have antibodies to part of your body? Would you like to have antibodies to your thyroid, which is integral to your metabolism? Well, autoimmune disease is on the rise. There's all sorts of autoimmune diseases, autoimmune thyroid conditions. There's autoimmune joint conditions like rheumatoid arthritis. There's lupus, which is a systemic throughout the body autoimmune disease. There's scleroderma, which is in the skin. There's Sjogren's, which affects the secretions. So there's all kinds of autoimmune diseases, and it's basically your body, your immune system gets confused and starts bang, 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 attacking itself. One of the mistakes that's made in dealing with hypothyroidism, given that 80% or more of the cases of hypothyroidism are caused by antibodies, is very few doctors will test for them. Very few doctors test it. They go in and they test something called TSH in your blood, thyroid stimulating hormone. If it's above what they consider the normal range, which I discussed in my vitamin D video, you can go back and listen to that, but the normal range for TSH has been debunked as being not the normal range. Even the American Endocrinologist Association years ago said, oh, that range doesn't work anymore. This is the range we see in healthy people. And so they'll tell you your thyroid is normal sometimes when it's not. That's one thing. But the other thing is when it does go into that abnormal range, they say, oh, you have hypothyroidism and we have a cure. Take this medication, it's called Synthroid. And what is it? It's synthetic thyroid hormone. It's synthetic T4, which is one of the two thyroid hormones. There's two, there's T4 and T3. And T4 is actually the inactive one, but the one that your thyroid produces. And it gets converted then to T3. So when you have hypothyroidism and they give you this drug, then it takes a while to get the doses right, and you may start to feel better, but you may not start to feel better. And a lot of times they just don't test for the antibodies. And if you've got these antibodies that are shooting bullets at your thyroid all day long, your thyroid continues to get destroyed, but you think you're okay because your thyroid symptoms went away because you're taking artificial thyroid. So what I do is I run a test. There's two different tests. One's called thyroid peroxidase antibodies, and the other one is called anti-thyroglobulin antibodies. Simple tests that you can do through any lab, any doctor's office, or you can go to directlabs.com online and order it yourself if your doctor doesn't want to order it. And if you have antibodies to your thyroid, that's no longer a thyroid condition. It's not a disease of your thyroid. It's a disease of your immune system. So if you just address autoimmune thyroid disease as a disease of the thyroid and give Synthroid, and some people will go, oh, and they'll give T3 as well because the T4 is not working, you're still addressing it as a thyroid condition. And when you start to look at it as an immune system condition, and you look at, well, why is my immune system gone haywire? What's causing it to go haywire? How do I repair it? And how do I repair the damage to the thyroid? Then you start to see results. And I see it all the time. I've had people come to see me 15 years of disease, of anemia, of symptoms, and the doctors prescribed Synthroid's not really working, and they don't know what to do. and we find that they have antibodies, and we get them on things like a gluten-free diet. We make sure their vitamin D levels are good. We heal their gut and make sure they no longer have leaky gut. We do all sorts of stuff to get their vitamin mineral levels up with fresh whole foods. We use greens and lots of good foods. We take out the allergens. Whoa, they start to improve. So if you're suffering, if you're on Synthroid, if you have thyroid condition, if you think you have symptoms of thyroid, hypothyroid, then it's worth it for you to get this test done. And then find a practitioner who can help you to treat it as an immune problem, not as a thyroid problem. It's really important. Okay? So I think that's all I have to say today. There's a lot more I could say about thyroid, and we'll do that on another video. But enjoy the process of regaining your health. One thing, if you don't want to go get tested at all and you're concerned about this, one of the things that has a really big bang for the buck is gluten-free diet. And if you start to do some searches on autoimmune thyroid and gluten-free, there's lots and lots of studies. So try that as a starting point. Doesn't mean that's the whole thing. Everybody's unique. There's probably lots of other stuff in there. And I go through that in my Assess Your Body, Assess Your Own Body Chemistry course, where I teach people how to actually take control of their own health by understanding how their blood works, what the symptoms on their body are telling them, how their bodily functions are working, and so that they can take charge. I teach all this in the Assess My Body program. Thank you.